I'm Laura.
And I'm Lisa.
And we're studying biomedical engineering at Duke University.
We're using light to improve breast cancer treatment.
Each year, over 268,000 women are affected by breast cancer. We hope that our technology will significantly improve their treatment and thus survival rates.
Tissue optical spectroscopy basically involves shining visible or UV light on tissue and reading its optical signature. An optical signature is based on the characteristic molecules found in a given tissue, such as hemoglobin and NADH. Because cancerous and normal tissues have very different optical spectra, we can differentiate between the two.
How are we developing this technology? Currently, we're working on 3 different levels to perfect our optical spectroscopy system. In the lab, we create tissue-mimicking phantoms, which are basically a liquid mixture of water, hemoglobin, and polystyrene spheres or lipids. The optical properties of these phantoms can be precisely calibrated, so they help us test limitations of our system. Second, we work with mice as our preclinical model. By giving them different kinds of breast cancer and monitoring their treatment, we can better understand what we're seeing in the clinic. Finally, we're working on multiple clinical studies, both for tumor margin assessment and treatment outcome prediction.
Because it is difficult to tell where the tumor ends and healthy tissue begins, 42 to 51% of patients require multiple surgeries to excise the remaining cancerous tissue.
As a breast surgeon, I am frequently faced with taking women back to the operating room 2 to 3 times over a several-week period to make sure I have completely removed their tumor. This is because there is currently no quick way to assess the margins of the breast piece that is removed during surgery. With this new technology being developed at Duke, which uses optical signatures, we hope to find a fast, effective way to make sure surgeons are right the first time they take a woman with breast cancer to the operating room.
According to our studies, by using optical spectroscopy during the procedure to analyze the tumor surface, we expect to reduce the re-excision rate to approximately 12%.
Another important but yet underexplored area where light can shed a lot of light is in the area of therapy, where right now the best tools we have actually look at how much the tumor has shrunk after a patient has undergone chemotherapy, which is essentially poison. And then there are many instances where this doesn't even work, and you have to wait 8 weeks to find out if it even had an impact. If we could use light-based technology to show what is happening to the biology of the tumor during the early part of therapy, then we could predict which patients would respond and which patients would actually not respond, so we could actually change the paradigm of therapy.
According to our studies, we should know if a treatment is working within 5 to 10 days. We think that the success of this technology in both tumor margin assessment and treatment outcome prediction will dramatically improve the efficacy of breast cancer treatment. Thanks for watching.